Welcome to an introduction to medical terminology. This lesson explains how medical words are formed, why they are important, and how to pronounce and understand them clearly. The original teaching page stays on the left. The yellow highlight marks the exact part being discussed. On the right, you will see an English explanation and its complete Arabic translation. I will speak English only. The first learning objectives are to describe the origins of medical language, analyze the parts of a medical term, list basic prefixes, suffixes, and combining forms, and use these parts to build medical terms. We also learn the general rules for correct word formation, pronunciation, and spelling. The page defines language as a system used by people to communicate through words and expressions. Words are the individual units we use to communicate. Terms, or terminology, are specialized words used in a particular field. Medical terminology is the study of the specialized words used in medicine. A medical dictionary contains many thousands of terms, so students do not try to memorize every word separately. Instead, they learn the parts of words and the rules that connect them. This makes difficult medical language easier to understand and use. The next pages introduce the English language and the languages of the world. English has developed through long historical contact between different peoples and languages. Its foundation includes Anglo-Saxon or Germanic language, and it has also borrowed many words from French, Latin, Greek, and other languages. This matters in medicine because many medical words come from Greek and Latin roots, while many everyday patient words come from ordinary English. Languages are often grouped into large families. The page gives examples of Semitic languages, Indo-European languages, and other language groups. Arabic belongs to the Semitic language family. English belongs to the Indo-European family. Understanding language families helps us recognize why some medical words look different from everyday Arabic words. The page also asks, what is medicine? Medicine is an ancient art and a modern science. It uses scientific knowledge, technology, communication, and clinical judgment to prevent disease and care for patients. The word doctor does not only mean a person who knows facts. A good doctor also needs clear language, careful listening, and the ability to explain complex ideas simply. The next section asks what the public expects from a doctor. Patients expect doctors to be intelligent and knowledgeable. They expect good communicators who can listen and explain. They expect team players who work respectfully with other healthcare professionals. They expect empathy, which means understanding another person's feelings and experience. They also value self-awareness and lifelong learning. Medical terminology supports these abilities because it gives healthcare professionals a shared, precise language. The next page explains why we study medical terminology. It is the language of medicine. We need it for communication and writing. We need it to know the pronunciation and spelling of medical terms. We also need it to understand word components and avoid misunderstandings. The page gives examples of abbreviations used in medicine. An abbreviation is a shortened form of a word or phrase. In clinical practice, abbreviations must be used carefully because a misunderstood abbreviation can cause an error. The page also introduces the idea of a root. A root is the central part of a word that carries its main meaning. By learning roots, prefixes, and suffixes, you can understand new terms even when you have never seen them before. Now study the key vocabulary page. Vocabulary means the words known and used in a language. A lexicon or dictionary is a collection of words and their meanings. A word may be a single word, an expression, or an idiom. A term is a word or expression with a special meaning in a professional field. Medical terminology is the study of terms used in medicine. Jargon is specialized language used by a particular group. Medical jargon can be useful between trained professionals, but it can confuse patients if it is not explained. The page also mentions the sources of medical terminology. Many medical terms come from Greek or Latin. Some come from the names of people, places, or diseases. Accurate medical communication depends on choosing the right term for the right audience. When speaking to another clinician, a precise technical term may be best. When speaking to a patient, a simple explanation may be better. The Arabic translation on screen shows the difference between general vocabulary, a term, medical terminology, and jargon. The next page gives basic foundations of medical language. Nomenclature means a system for naming things in a field of knowledge. In medicine, nomenclature helps us name body parts, diseases, procedures, and medicines clearly. A syllable is a part of a word pronounced as one unit of sound. For example, a medical word may be divided into several syllables to make pronunciation easier. The vowels in English are A, E, I, O, and U. A consonant is any letter that is not a vowel. The page also introduces terms such as acronym, eponym, and antonym. An acronym is a word formed from the first letters of other words. An eponym is a word taken from a person's name. An antonym is a word with the opposite meaning. The word-building diagram shows prefix, root, and suffix. A prefix comes before the root. The root gives the main meaning. A suffix comes after the root and may describe a condition, procedure, or specialty. A combining vowel helps join word parts together. Learn to identify these parts before trying to pronounce a long medical term. Let us practice how to break a medical word into parts. In cardiology, cardi is the root, meaning heart. The O is a combining vowel that joins cardi to the suffix logi. Logi means the study of. So cardiology means the study of the heart. In dermatology, dermat is the root, meaning skin. The O is the combining vowel, and logi means the study of. Dermatology is the study of the skin. A prefix can change the meaning of a root. A suffix can describe a disease, a procedure, or a specialty. When you meet a long word, do not panic. Look for the root first. Then identify any prefix and suffix. Finally, use the Arabic translation on screen to check your meaning. This method helps you read terms accurately and understand how medical vocabulary is organized. This section compares some features of English and Arabic. English often builds compound words by joining two complete words. For example, homework is home plus work, and bodyguard is body plus guard. In medical English, many terms are also built by joining word parts. Arabic rarely uses derivation in this way. Now read every entry in the historical derivation table as a complete word. Artery, Latin and Greek arteria. Cardi, Greek cardia, meaning heart. Cell, Latin cella, meaning a small chamber. Gene, Greek genos, meaning origin or birth. Hernia, Latin hernia, related to rupture. Sinus, Latin sinus, meaning a cavity. Tendon, Latin tendo. Nerve, Latin nervus. Vein, Latin vena. In medical word building, cardi is the root meaning heart, and the O in cardio is a combining vowel. These origins help learners recognize repeated meanings in new medical terms. Use the Arabic translation on screen to check each word and meaning. This page gives notes about Greek and Latin roots in medical terminology. The table begins with skin. Skin. Dermatos, Greek. Dermat. Dermatitis, inflammation of the skin. Cutis, Latin. Cutane, cutaneous, pertaining to the skin. At the bottom of the page, dermatitis means inflammation of the skin, and cutaneous means related to the skin. Next, kidney. Nephros, Greek. Neph. Nephroma, a tumor of the kidney. Renes, Latin. Ren. Renal, pertaining to the kidney. At the bottom, nephroma means a kidney tumor, and renal means related to the kidney. Then, mouth. Stomatos, Greek. Stomat. Stomatitis, inflammation of the mouth. Oris, Latin. Or. Oral, pertaining to the mouth. At the bottom, stomatitis means inflammation of the mouth, and oral means related to the mouth. Read the Arabic translations on screen for every term in the table. This table shows that different Greek and Latin roots can carry a related medical meaning. The final page introduces pronunciation and definitions. Phonation means the production of vocal sounds. An accented syllable is the part of a word pronounced with greater emphasis. In medical vocabulary, stress is often shown by writing the accented syllable in capital letters. The page also includes examples such as cyanosis and mydriasis. Cyanosis is a bluish color of the skin or lips caused by low oxygen in the blood. Mydriasis is widening or dilation of the pupil of the eye. Intonation means the rise and fall of the voice when we speak. Good intonation helps a listener understand whether a sentence is a question, an instruction, or an explanation. When you learn a medical term, study 3 things: its meaning, its spelling, and its pronunciation. Break the word into syllables, identify the root and suffix, then say the stressed syllable clearly. This completes the introduction to medical terminology. Use the Arabic translations on screen to review each key concept and practice the English terms slowly and accurately.